Good afternoon, everyone, and welcome to another webinar of Hive Medical Academy. So please give us a few minutes because we are expecting a few more people to join. So we'll start around 3:05. Right. Thank you so much, everyone, for waiting and giving opportunity others to join. So we're going to make a start quickly. Before I pass over to Asma, our executive member, Asma will give you a brief intro about the Hive Medical Academy. Then we have got Dr. Omar, who is academic lead for Hive Medical Academy. He will take you through the today's webinar topic in detail. Then we have got Imtihal Mariam. She is our executive member and she will take and handle the question answer session at the end. So we'll be here for to answer any question regarding your journey to uh, UK for the NHS. So over to you, Asma. Thank you.
Thank you, sir. Thank you so much. Hello, and a very warm welcome to everyone joining us today. My name is Asma, and I am an executive member of Hive Medical Academy. It's an honor to be here with such a bright and passionate future doctors. Hello and assalamu alaikum once again. Let me first introduce what the Hive is. Hive Medical Academy is based in UK, Manchester. We are dedicated to guiding IMGs step by step in their journey to becoming a successful doctors in the NHS. From English language training to PLAB1 and PLAB2 preparations, right through GMC registrations, clinical attachments, CV buildings, and job placement in the NHS. We provide everything under one roof. What makes Hive unique is not just a course we offer, but the personalized mentorship from experienced doctors and the NHS consultants. Our vision is simple: to make your PLAB journey smooth, stress-free, and successful. So today's webinar is focused on a very important part of PLAB2 exam, telephone consultation. This is a key skill tested in PLAB2 and mastering it for clear communication, patient safety, and exam success. Together, we will explore techniques, common scenarios, and tips to help you perform confidently in your exam. I'm very excited to be in this part with you all. And thank you so much, Imtihal and the NHS team for joining us. Imtihal, we are waiting few more participants to join. Then we will begin our session. Also, everyone, if you have any question, feel free to drop in comments. We will answer you at the end of this session. I request and I repeat, if you have any question, feel free to drop in comments. We will definitely answer you at the end of this session. Maybe this will be longer now. Let's make this session more productive with the most graceful and one of the busiest personality I know, whose voice I really get to hear. None other than our academic lead, Dr. Umar. Over to you, sir.
Thank you, Asma. Such a exciting and passionate introduction. I hope I can follow on and be as exciting as you were in that introduction. Thank you. Thank you to everyone for joining, and to all the rest of the team for all your hard work that you always do. Thank you for giving time on a Friday afternoon. Okay, so we've got a PowerPoint presentation, and so I will just share my screen. Somebody can confirm.
Yeah, we could see the same. Yeah.
All right, brilliant. Okay, so Asma's already mentioned a little bit about Hive and the Academy. So I don't need to go over that too much, but just to let you know, both myself and Dr. Shakil worked in the NHS for a very long time. And now we're fully focused in helping the people who want to join the NHS, helping train them, prepare them for their examinations, as well as helping them in their future career choices once they have passed as well. So if you're interested in exploring our services, please do visit our website. We'll be very happy to speak to you and give you some advice. Okay, so we're discussing telephone consultations in PLAB2 today. Now, I do tend to have a bit of a habit of getting very detailed and getting into lots of waffle, and so maybe lots of people lose attention fairly quickly. So I'm going to try to keep it quite brief today, no more than 20 to 30 minutes, and give plenty of time for you guys to ask some questions. But in terms of the learning objectives for today, by the end of the webinar, what we will have done and what you guys will be able to do is understand, firstly, how telephone consultations are used in clinical practice. And because they are used in clinical practice, that's why they are tested in PLAB2. That's first off. Secondly, we want to be familiar with the types of scenarios that could come up in a telephone consultation station, so that you are better prepared for what to expect and how to proceed. Thirdly, we will discuss how to tackle telephone consultation scenarios in a patient-centered manner. As we always say in any of our talks and any of our courses, that PLAB2 is all about being two things mainly. One is safe and one is patient-centered. And so we'll be discussing that today. And finally, we will discuss how you can triage, assess, and even examine patients in telephone consultations or get information that will help you examine patients and decide how to proceed with the scenario that's placed in front of you. So there are objectives for today, and so we'll move on to discuss how they are used in clinical practice. And having been a family physician consultant for 10 years in the NHS, I can tell you reliably that telephone consultations are a very, very important part of clinical practice, particularly in primary care. It's more focused towards primary care where they tend to get used. So what kind of scenarios can they be used in? So initial triage, since COVID in particular, before COVID, there were many forward-thinking clinicians and practices like the one I was involved in before moving into education full-time, where we used to use triage, use telephone consultations to triage every single patient that wanted to see a doctor. So this has been going on for a long time, but especially since COVID, and COVID came, and so we couldn't see patients face to face. And then it became an even more important part and became so widely used that now probably the vast majority of places you will still have to have a telephone consultation before you can speak to a doctor in primary care in the UK. So triage is really, really important. How else do we use the telephone calls? We use them for follow-up discussions. So we use them after we have seen patients, assessed patients, managed patients. This can be to discuss test results. It might be to follow them up and see how they are doing. How have their symptoms improved, changed, resolved, got worse, whatever it might be. It could be safety appointments that we make to review the patient. Or we could have discussions around things like medication reviews, which are done a minimum of annually for patients who have chronic diseases, and they may be done more frequently in other scenarios as well. So discussions, follow-up is the second type of use in clinical practice. Thirdly, managing patients remotely, whether that's a chronic disease review, whether it's helping to give advice for minor illnesses. We do manage patients remotely as well, and obviously assessment is part of that. But we can, the point here is that telephone consultations are not used just for triage. They are also used to assess and to manage the patients, and you can fully, safely and competently manage someone with a minor illness through a telephone consultation without any concerns about safety, as long as you safety net and put into place good advice for when and how to follow up, or in what instances for them to seek medical advice again. But the bottom one is the one that I want to highlight the most, and that is that if a patient can book a telephone consultation to speak to you, then that means they are free to book to discuss anything. So ultimately, that means just like in primary care, just like in A&E, where you expect anything can walk through the door, so telephone consultations are the same. You might be speaking to a patient who has had this arranged, it's been done in advance, and there is no acute concern. Or you might be speaking to somebody who's potentially very seriously unwell on the other side of the phone, and you have to make a decision about how to assess them, where to send them, whether to go and visit them to assess them, or any other kind of emergency response that might be appropriate, even sending an ambulance to the address, for example. So the most important thing to remember is that if you are doing a telephone consultation in clinical practice or in your PLAB2 scenario, it could be anything on the other side of the phone. And so you would assess it in a similar way to somebody who is coming to you face to face, without, of course, the benefit of visual cues, without the benefit of being able to see the patient, see their body language, see how they are breathing, and all of these other kind of things you notice in a face-to-face consultation. So what kind of PLAB2 scenarios could come up in a telephone consultation? So any kind of scenario where a patient wants to discuss symptoms. This can be any type of symptom, can be serious ones like chest pain, abdominal pain, headache, shortness of breath, could be mental health presentations, or there might be some minor symptoms like they've been having, when we say minor, what we mean is non-serious, not emergency potentially, where they've been having pain in a joint for quite a long period of time, or they've been having some kind of musculoskeletal problem. So any kind of symptom could be discussed in a PLAB2 scenario telephone consultation. Now, how would you proceed to assess? We'll discuss that in detail over the next couple of slides, but the most important thing is obviously you have to get as much information as you possibly can over the phone, and you have to try to make a decision or use that information to make a decision about whether you need to advise that patient to book a face-to-face appointment, whether someone needs to go out to see them, or whether they need to be advised, whether they need to have arrangements made for acute admission. But we'll speak about that shortly. You might get a counseling type scenario. Now, counseling is obviously where you are counseling the patient. You are explaining something to them, exploring their concerns, discussing something that's important to them, or something that you have that needs to be discussed with them. So this could be an investigation result that you have to follow up, or you have to explain to them, you have to tell them, you might have to tell them it's normal, you might have to tell them it's abnormal. We don't like to break bad news over the telephone because it's not a good way to do it. So you probably won't have to do that over the telephone. However, we can never say never, but ideally that wouldn't really happen. But you might have to give a diagnosis, you might have to give advice, or you might have to explore something that they are concerned about, and that's why they have made a telephone consultation. So a counseling type scenario is possible. There may be an administrative or medication type request, so a request for a prescription, a request for a fit note, which is otherwise known as a medical certificate, commenting on the patient's fitness for work, or whether they are not fit for work, or it might be something like a request to renew a contraceptive pill prescription. So again, it's a different type of scenario, which still needs you to get as much information from the patient as possible, use the information that you have in front of you in the scenario, and then proceed as appropriate. So administrative or prescription or medication type request. And the fourth one that we think is the most common type of request for, type of scenario for telephone consultations is a third-party consultation. Now, what a third-party consultation means is where you are speaking to somebody who is not the patient, but they are calling with either some concern or some worry about a relative, usually. So it will usually be a parent in relation to a child, or it could be an adult calling about another adult. So it could be a sibling, it could be a parent again, an older person calling about an adult patient. for something like mental health concern, for example, they're having an issue, or they have concerns about them. And in this kind of scenario, you may or may not have, the third party who's calling you may or may not have discussed this with the person who they're calling regarding. So issues like confidentiality come into it, and we'll discuss this towards the end of the presentation and explore how you can navigate them kind of concerns. So what is a good way to proceed in a telephone consultation? So as I said previously, don't treat them hugely differently to a face-to-face consultation. Obviously, there's a limit to the amount of visual information and how you can respond to non-verbal cues, etc. But the rest of it should be the same. So you should confirm who you are speaking to, what's the identity, their name, the date of birth, their address, ideally as well. You should gain consent to proceed, but also before doing that, you should check that the timing and the situation is appropriate. So, for example, you might be speaking to somebody who is currently at work or is currently in public, and it might not be an appropriate time. We obviously the scenarios in PLAB2 reflect real life, and so they do that in exams as well. So you should behave in the same kind of way and check that it's appropriate to continue the discussion, because they might want to discuss something embarrassing, something that's private, and so confidentiality should come into it. If they are alone and they are in a private environment, in their house, in their room, that's probably okay. If they're in a public space or if they're at work and other people can hear the conversation, it's probably not appropriate. So you should check that the timing and the situation is appropriate. You need to structure the call just as you would structure a consultation. You need to proceed with an open question. You need to gather information. You may need to, depending on what the type of request is, you will need to gather information. Of course, you may need to take a history. You may need to ask open and closed questions to enable you to then proceed to decide how to best manage the situation. And then, of course, close the consultation and the conversation by thanking them, mentioning what's going to happen next, etc. You do need to show empathy and active listening. What that means is, just as you would in a face-to-face consultation, you do need to, if the patient shares something that feels appropriate to respond to, you should do that. You should thank the patient for sharing stuff that is perhaps potentially private or embarrassing or difficult for them. You should show empathy. Thank you, Mr. Johnson, for sharing that with me. I understand it's been a difficult time for you, etc., etc. And how you show active listening is by responding to their verbal cues. So if they mention something, that feels appropriate to respond to, and we discuss these kind of things in more detail in our courses. But you should reflect that back to them, and obviously the way you speak and your tone of voice, that is all important as well. Finally, of course, safety netting and follow-up is important. So again, depending on what kind of conversation you are having, what's the task for the telephone consultation, you do need to remind the patient or mention to the patient that in a particular scenario, if so-and-so symptoms occur, or if this happens or that happens, you need to seek medical advice or seek urgent medical advice, and mention to them when you will be following things up and how you will be doing that. In terms of triage and examination, triage is where you decide the urgency of a presentation and how best to manage it. Now, obviously, that might be self-care in the case of a minor illness versus a GP review, a general practitioner review, a family physician review, which can happen with a home visit, or it can happen in the clinic itself, versus an A&E type presentation. So that can be decided fairly early on in a telephone consultation. But even if you do feel that they require emergency assessment or an urgent intervention, don't stop the telephone consultation at that point. Obviously, you have to use the time in your station, continue to take information, put into place, say that you're arranging things that need to be arranged, or you're arranging to come out and to see the patient and assess them further, etc. So do continue to take information. In terms of assessment, use the same tools that you would in a face-to-face consultation. You need to take a history, a focused history. You need to explore red flags around the scenario. You need to explore the psychosocial context within which the patient is, and you need to explore ideas, concerns, and expectations. In terms of examination, obviously that's very difficult through a telephone conversation, but asking things like, can you describe the rash? Or are you able to walk to the bathroom without getting breathless, can be helpful. Obviously, you might be able to figure out certain things from the way they're speaking. For example, are they able to complete sentences without pausing for breath? Do they sound as if they are in pain? Might it be appropriate, if it's a dermatological presentation, to ask for a digital image, for example? So there are lots of things that you still can do in terms of trying to get information for examination. But ultimately, depending on the presentation, you might need to say that the patient will need to be assessed face-to-face in order to proceed further. And in terms of safety netting, of course, that is going to be important as well. And as we've mentioned in the previous slide, you need to give clear advice on what to do if things get worse, or what to do in particular scenarios. Just before I proceed, in fact, no, we'll discuss it in the scenario example. We're almost at the end now, so don't worry. As promised, it will be a short presentation. This is a typical kind of scenario, and it's one of the ones that we mentioned you could possibly get, and it would be, it'd be useful for us to discuss this and see if anybody has any ideas or any things that they feel are important in this kind of scenario. So you are an FY2 in general practice. This is how PLAB2 scenarios are worded. Mrs. Sarah Golding has booked a telephone consultation to discuss some concerns she has about her brother's mental health. Mr. David Marsden, age 21. Please assess the situation and proceed as appropriate. So do we have anybody on the who has joined the session who feels like they want to make some suggestions about what's important in this scenario? Things like, how are you going to open? What kind of things are going to be discussed? What can you discuss? What can't you discuss? All of these kind of things. It's a good example, quite a typical PLAB2 scenario, and there are lots of issues that are raised here. So it would be really helpful if we had some participation from the audience. Feel free to unmute yourself, raise your hand, although I don't think I can see raised hands because I've got the screen shared, but please feel free to jump in and just share your thoughts on what you think, how you would feel about this kind of scenario.
I would encourage Dr. Shahid, who will be coming to UK very soon to us for the
That's a
PLAB2.
great idea.
Yeah, Dr. Shahid, please.
Yes.
Good, thank you. Yes, please help us out, Dr. Shahid.
Sir, I'll probably start with the most important thing at the start would be introductions, confirming the patient identity, age, name, and things like that, and then go ahead with the complaint her sister feels he's having. I mean, go ahead and ask the details, as many things as possible regarding the symptoms she has figured out. And then we can also talk about the triggers, if there is any other symptoms related to the same mental health issues. After exploring his original symptoms, then we can explore other symptoms, like asking about the other symptoms related to his mental health. And then probably I'll go ahead to do differentials and also red flags, asking about any self-harm, any appetite loss, any symptoms, any effects of his symptoms on his daily life and health, and asking about the previous medical history, like he had this kind of symptoms before or not. Is he using anything for this particular symptoms, and effect on his daily life, things like that. And then we'll go ahead with ICE, asking a few things related to the concerns and expectations and ideas. And then go ahead with, because there's patient is not present there, so probably we'll not be going ahead with the examination, and then explaining the diagnosis, and then measures we can do. Measures can be done by the patient himself, and the measures which doctors can do. And then in the end, we'll go ahead with the safety netting and leaflet if possible, and things like that.
Yeah, excellent. Thank you very much, Dr. Shahid. Very comprehensive comments on what kind of things to explore. And I'm glad you mentioned all the pillars there, the 3 pillars that we always talk about in terms of data gathering. So that's very good. I have a couple of questions for you. So just to test your understanding, if you don't mind. Is that okay?
Yes, sure. Of course, I'll be asking you questions basically, but anyway.
Yeah, that's okay. No, it's just
two-way
it's
traffic
not
is good.
Yeah. It's not to put you on the spot. It's just to get you to think about these things.
No worries.
Yeah. So the first one is are there any confidentiality issues in this kind of scenario?
Yes, sir. Because we know the sister is calling, and we don't know if she has got any permission or consent from the patient. So of course, it is going to be one of the important things.
Excellent. So what that means is that we're not going to give any information to Sarah Golding regarding David Marsden, but we're free, aren't we, to collect as much information as we want, isn't it? Yeah, so we can take all the history, we can take all her concerns, we can take all her perspective without any issues. But if she requests information, for example, if she says, when's the last time David came to see you? At that point, you're going to have to highlight that you're not able to share that, aren't you?
Yeah, sure.
Exactly. So that's one important point to consider. But mostly, this won't be an issue because you're taking information from her. The second question that I have, or second issue for you to consider, to think about, is depending on, obviously we don't have any details yet, what are her concerns, etc. But if there are any symptoms to suggest any kind of significant mental disorder, whether it be depression, anxiety, psychosis, or any of the other mental health disorders that we worry about, then how are we going to bring up the issue of assessing this patient? How are we going to speak about that in this consultation?
Basically, I didn't really think about that point, but probably if we find out there are safety issues like self-harm and things like that, there is one option we can explore is the crisis team. If I'm not sure if you mean to ask about that particular thing, and also
go on, go ahead. Yeah.
Also, if we feel there is any significant harm or possibility of harm or any significant symptoms, probably will encourage the patient to bring the patient to the clinic, to this GP surgery, so we can reassess him and properly assess him,
Yeah.
and then see if there is any need for admissions or referrals or things like that. Probably that is one thing I would
Excellent.
consider.
Yeah. So you mentioned a couple of very important points there. That sometimes crisis team is actually they work in the community. They usually deal with patients who have attended hospital and then are being managed safely in the community. So the crisis team isn't exactly the right team, but you're on the right lines. There are things that we can do or organizations that we can consider referring David to. However, let me frame it, and you also mentioned, if there's a risk of self-harm or harm to anyone else and all of these kind of things. You're absolutely right. But I was more interested in the third thing that you mentioned, which was we could consider bringing him to the surgery, or some other way of assessing him. So from my point of view, anybody who is potentially suffering from a mental health condition will need a face-to-face assessment, because we need information from them. We need to be able to look at them. We need to be able to speak to them directly. We need to be able to explore things with them directly. And as you rightly said a few minutes ago, the patient isn't present here, isn't it, in this consultation?
Right.
So we can get as much information as we need or as we can get. However, when finishing off this consultation, provided there are no immediate risks based on your conversation, I would suggest that we should say that it's been very helpful speaking to you, Mrs. Golding. Thank you for sharing all of them concerns. We do need to, however, assess Mr. Marsden face to face ourselves to be able to make a diagnosis more accurately, and to assess the severity of his mental illness and what we need to do next. So that can be done in a number of ways. He can be brought to the clinic here. If there are sometimes mental health patients might have poor insight, or they don't think they're unwell, or they don't want to go out, and so the family might have issues bringing them, in which case we can say, if that's an issue, then we can come out to visit Mr. Marsden. We can come to see him at home.
Right.
Yeah. And then the final thing is, if, as you rightly mentioned, that if there are serious concerns about risk to himself or somebody else, then we might need to arrange what's called a Mental Health Act assessment. I don't know if you must have heard of that in your PLAB1 preparation.
Right.
Yeah. So that's an assessment, but where there's a psychiatrist, actually two psychiatrists independently, plus a social worker. Sometimes you might need to involve the police to gain access to a property if you're having issues, etc. But they make an assessment to decide whether the patient needs hospital assessment and treatment against their will. Because as we mentioned, usually insight can be an issue. Right. So there are a number of different ways that we can do it. But even that final one, in terms of a Mental Health Act assessment, you should be seeing the patient yourself, or at least attempting to see the patient yourself first. Nobody will, perform a Mental Health Act assessment for a patient based on a third-party consultation that you had with a family relative. Do you see? Right. So you have to make an attempt to see this patient face to face. Sure. If, for example, they don't come to the surgery, you've tried to visit, you don't have, they don't give you access to their property, at that point, then you will say, we need a Mental Health Act assessment because I feel this patient is seriously unwell and needs hospital assessment and treatment. Right. So the face-to-face assessment is essential, has to be done. Essential, yes. Yeah. So so hopefully that gives some idea of the kind of issues that are relevant to this kind of scenario. So very well done, Dr. Shahid. That was a really good understanding of the issues that are important. And obviously we together we filled in some of the gaps there with real world practice, what happens and what you need to say in a PLAB2 kind of scenario with this, if you're faced with this kind of consultation. And of course, you have to do all of that in 8 minutes.
Yeah, that's a big
Yeah,
challenge.
it's a challenge, but obviously that's the kind of thing we work on in our courses. So thanks very much, Dr. Shahid, for that
No worries, no worries.
contribution.
Happy
Dr.
to be
Steele,
here.
do you want to add anything else to that or?
No, that's great. I think Dr. Shahid has finished our online course. The wording I heard about the crisis team, normally IMGs, they are now aware of the crisis
That's
team.
true. That's true.
Looks like he has finished our online course. That's why it's crisis team, those things. So yeah, most important is the red flag, especially in mental health patients. Red flags is very important. Life-threatening conditions, you need to exclude those. And you are just FY2. They are not expecting anything. Just ask for the help. Wherever you are stuck, let's say, okay, yeah, let me get second opinion. Let me get my senior involved, and we'll get things sorted out.
Right.
Yeah,
Right.
that's right.
Well done. Very well done.
Well done, Dr.
Thank you.
Shahid. Thank you. So that was just one type of scenario example. And there are many different types. But to summarize, telephone consultations, they test communication skills, they test your knowledge of safety and clinical judgment in a huge variety of scenarios. And we go through lots of them in our courses. As we've mentioned, always confirm the identity, appropriateness of the time and the setting, and structure the call as you would do in a normal consultation. Remember staying patient-centered, empathy, reassurance, shared decision-making. Remember red flags. If they are present, explore them. If they are present, always provide safety netting and always seek help. So structure, safety, and empathy will result in a high score. So that was all from myself in terms of the presentation. So I'm going to hand back over now to, hopefully it was useful. I'm going to hand back over to the team so that we can answer any questions. Thank you very much.
Thank you so much, Dr. Umar and Dr. Shahid, for sharing such valuable and insightful information with us. I am Imtihal Mariam, Executive Member at Hive. Dear listeners, the platform is now open for you. Please feel free to ask your questions. Dr. Umar is here to answer and guide you. Thank you.
So please feel free to unmute yourself, or you can type the question in the chat box, whatever is comfortable and convenient for you guys.
Yes, and you don't have to stick to the topic of today. If you have some about today, that's brilliant. If not, if it's about anything else, the PLAB journey, any other concerns, please feel free.
So no question means everybody knows everything.
No,
Yeah, no. It's no question means
means
everybody
too
knows
many
everything.
questions. Too many
Or
questions. So
yeah, that's right. Yeah.
sometimes. Yeah, I probably have asked Dr. Omar before as well, but
Sure.
it is still kicking my mind again and
No
again.
worries.
Especially when we are diagnosing a case, sometimes we have some similar, scenarios, like let's say headache cases. There are several headache cases as well. I'm
Yeah.
just giving an example.
Sure.
Or other skin-related issues or things like that. If by chance we mix, we are able to diagnose the case, but we mix the management, and we don't know what medication is to be prescribed for that particular. If we forget that, and what dose,
Yeah.
what would you suggest for that kind of scenario?
So you're right, you have asked this question before, but that's okay, no problem. We also in the face-to-face course we did recently, we covered this many times. If you feel unsure, the best thing to do is to share your thinking. So be open about it. Say you are unsure, because it's perfectly, it might be different elsewhere, but in the UK, in the NHS, we welcome uncertainty, and it's actually a good thing. It shows that you are aware of the limits of your competence. because you're not a dermatologist and you're not a
Yes,
neurologist or you're not, you
yes,
know, a specialist. So it's fine to feel unsure, but to say if you are thinking of 2 or 3 things, ideally not too many, not 4 or 5, but you know, a couple, maybe 3 at the most.
yes,
2, I say, you know, is a good
yeah,
good
right,
kind of discussion to have. So say it could be this or it could be this, and then share
right,
your knowledge of what would happen in each scenario or what should happen
right,
in each scenario. And again,
right,
even if you don't remember the specific medication name, the specific medication dose, do 2 things. One, share that you can't recall it at the moment. Share with them whatever it is you know, whether it's the medication class that
right,
the drug belongs to, or
right,
you know, something about the medication, the way in which it acts, how it helps the patient, and say that you're going to do 2 things in order to help you ensure that in this consultation you do the right thing. Number 1, you're going to check the BNF if you have an issue with, um, you know, remembering the specific drug or the medication. And number 2, you're going to discuss with a senior to get some advice on, you know, which of the 2 are more likely, and so which management line you should proceed down. In that way,
right,
what you will do is you will not look confused, you will not be silent, you will give the examiner the confidence that, okay, maybe he or she isn't sure. However, he or she has told me that they're going to, he's told me what he is thinking, what he or she is thinking, and it seems reasonable. That's a sensible suggestion for differential diagnosis and a management plan. And how he's
right,
going to proceed further is he's going to check the appropriate resources and he's going to discuss with the senior. You
right,
can still comfortably pass that station, no problem
right,
whatsoever.
right. Thank you, thank you.
Dr.
Yeah,
Steele,
few things. Yeah,
elaborate
just
on
few
that.
things I want to. Yeah, a few things I want to add. You know, we need to be very clear what they're assessing in PLAB2. You know,
Yeah,
PLAB2, they are not want to see you perfect or you will make the diagnosis or you give the final. They want to see how good you are in communication, how safe
right,
you are, how open you
yeah,
are, how honest you
right,
are. Simple
right,
as that. You know,
right,
I always say to students, you know, even you go for the station and something comes which you never heard about it, but still you
right,
have a lot of things which you could do to pass your station. You
right,
know how to greet the patient. You
right.
know how to, you know, take the history. You know how
Sure.
to explore it. You know how to
Yeah,
explain it. And even at
right,
the end of the day, you know, end of the session, you don't know what's going on. Simply say, yeah, oh, I don't have any clue what's happening, but I need to ask my senior. I'm going to discuss with my
right,
colleague. I'll get back to you.
right.
Because, you know,
Sure.
you will be starting your first job in NHS. So you will be
Right,
trained there. You will learn more
right,
things. So they want you how you can ask for the help, and they want to see
right,
what are your limitations. Are you aware of your limitations? Are you going to do
right,
everything yourself? Okay, you have the subarachnoid hemorrhage. I'm going to do surgery as well. No, not at
right,
all. You should be
right,
well aware of your limitations. Oh no, I have to stop here. This is not
right,
my field. I'm going to ask
right.
for the help. So this way
Sure.
they check your, you know, how good you are team worker, how good your
Right,
team player. You know your
right,
limitations, and you're not going
right.
to give any wrong information to patients.
Sure. Sure.
They don't expect any PLAB2 candidate to confirm the diagnosis. It's very
Right,
easy. Yeah, you know that if you don't know, yeah, there are lots of
right.
other people. You'll never be working on your own in hospital. So you'll have full
Yes,
team. So rest assured, rest is, you know, when you come in the UK, in the academy, you'll have loads of practice. All
Yeah.
right.
these sort of scenarios, everything you'll
Yes.
get and you'll have loads of practice.
Sure, sure.
You'll be perfect. Don't worry.
Yeah, thank you. Thank you.
You're welcome. Any other
And
questions apart from the very... Sorry, Imtihal, please go ahead. I forget sometimes that I'm not sharing.
any questions?
Yes, I would also like to ask a question.
Yes, please.
So, what's the most challenging thing about PLAB2 and how can students tackle it? What do Pakistani students in particular find the most challenging about PLAB2 exams? Can you please brief on that?
Dr. Scale, I think that seems a relevant question to yourself, having gone through the journey.
You know, yeah. the most important thing is the cultural difference, is the communication and adapting to the communication style. You need to be polite, kind, basic communication. Learn to say please and thank you, which we teach to our children. So you understand, like, you should know where they are coming from. There's a, there's a story behind it. When I was new, so obviously I graduated from Pakistan, came here in UK, started everything. So my communication was not that good. New job, new everything. So obviously most of the things in English you don't understand. You know what they're saying. So I was, one of she is our executive member and now manager now here. So she is with me since I started my first job, Karen, in Stepping Hill. So we were discussing something and we were sitting in the cafe and she said, "Oh yeah, I understand where you're coming from." So she was right, but I was new in the UK. Communication was not that good. I thought, my God, she's thinking I'm coming from Pakistan. She's very racist. So, I thought that, my understanding was she's saying, oh, she knows where I'm coming from, Pakistan, backward country, and this. So I didn't speak to her for 1 week. So she was, every day she was saying good morning, but when she stopped me one day, what happened, mother? Why are you not talking to me? So I could not tell her that, I didn't like it. Then she asked me again and again. So I said, oh, Karen, I didn't like what you said. You said, you where I'm coming from. And I felt very offended. And, this is not good. So what I'm coming from Pakistan. So she started laughing and smiling. Then she told me it didn't mean that. It means, I understand your point of view. So it happened to many of many of others international medical graduates, and I have seen this when I was a consultant. I was working, several other junior doctors were working with me. So this is the biggest challenge. They don't understand the local dialect, the local language, the local slangs as well. So it's very important, starting from simple things, starting from saying thank you and please, and then understand the cultural difference and come across, very good professional way of communication. So this is what is the biggest challenge, and what we do at Hive when they do face-to-face course, we have the special consultations where we discuss everything, how they're going to communicate with the patient, how we're going to speak in MGP, how they're going to do the presentations, and how going to set all these things in their career. Dr. Mu, you want to add something more? Because
No, I agree
know
completely.
better.
I know the story is very funny, but it's also got a really serious side as well. In that, these like Dr. Skill said, the nuances of communication are very, very important. And even before you get to the clinical situation where you are interacting with your colleagues and patients and stuff, you have to do this in the exam. And the actors are, they're real British people who speak in the way that British people speak, and your patients will speak. And so, understanding what their phrases mean, understanding how your phrases will be interpreted is very important. We did a lot of that in our recent August course, because these are just, it's not the candidate's fault. This is how they have learned to speak English, and so we have to kind of change the way they say certain things, to just make them more appropriate. So communication, definitely, I would say, I agree, is the hardest thing, and we work on that a lot in our courses. Thank you for the question, by the way. Great question.
Sir, am I audible?
Yes,
Yes.
you are loud and clear.
So I have a question in here. If I clear both PLAB1 and PLAB2, but for any reason I'm not able to secure my job in the NHS, can I still complete my GMC registration through Hive Medical Academy?
Thank you so much for your question. Yeah, definitely. Once for the GMC registration, the requirement is to pass the PLAB. Once you have passed your PLAB, we'll help you to we'll review your CV. We'll make sure your CV is up to date according to the standards and templates. and there are no gaps which are not justifiable. Will help you to complete your GMC registration form, and you will get the registration within 24 to 48 hours. There is no restriction for you that you can't get it once you have passed the PLAB. Hope that answers the question. Mariam, have you got any other question?
I have a question, sir.
Yes, please.
Oh,
Am I audible?
Yes, you are.
yes.
Sir, I have a question which is regarding PLAB1.
Yeah.
What I would like to ask, sir, which is the best way to balance question bank practice with theory revision in PLAB1?
Okay.
All right.
Shall I
Yeah.
take this question? Yeah,
Please.
thank you. Really good question. So it all depends on what kind of a learner you are. So we all know that we all have different learning styles. Some of us are visual, some of us are audio learners, and some of us learn by repetition. So what we do in our courses, and in fact I've got one call immediately after this meeting as well, is as soon as you register with us, what we do is we have a conversation with you. We try to understand where you are coming from. No, I'm just joking. We try to understand your background, your experience, your clinical and academic experience, your own understandings about how you learn best. And then what we do is we discuss the best possible strategies based on your, based on the information that you share with us. And that might be that, first of all, we feel that, oh, there's probably lots of learning gaps. What you should do is you should watch lots of our videos first, or if you're an audio learner, listen to lots of our audio lectures first before trying to attempt questions. But there are different ways. You can break things down by subject, by specialty, and do questions as you go along, or you can do all the learning or majority of the learning first, and then test your knowledge in mock exams. So it really, there's no one size fits all strategy, and there's no one way to do things. It all depends on the individual, what their strengths are, and that's what we discuss with the person once they have registered with us. So I hope that helps.
Also,
Thank
our
you.
courses, they are diverse. Like we have audios, videos, we got flashcards, and we have got mock tests. So our courses meet the requirement of every individual. So you get everything. And once the candidate, they contact us in the first consultation, we give them the proper study planner according to their, either they're working or the full-time want to study, whatever. So we prepare their study planner according to their requirement. So that helps them to pass their exam in first attempt.
Thank you, sir.
Thank you.
Yeah.
Sir, with your permission, I have a question.
Yes, please. Yeah.
I have question regarding post-examination. Like when I'm done with exams like PLAB1 and PLAB2, afterwards, what kind of support I can expect from Hive regarding NHS jobs, interviews, or adapting to UK clinical practices?
That's a very important question you asked, and this is all the IMGs must consider this one because real struggle starts after passing the PLAB. Passing PLAB is a piece of paper, or just another certificate. And if you could not secure the job after passing PLAB, then it is no point. So post PLAB, most important thing is first thing is your CV, your clinical attachment, your CBD courses, the resources, and your interview, your local references. So what we do, we provide guaranteed clinical attachments because we know that passing PLAB is, yes, that you got the GMC registration, but after that is the real struggle. You need to meet all those and you need to complete all those requirements to secure a job within 6 months of your visa status. We review their CV. We prepare their CV according to NHS template. We prepare them for the mock interview. We have got live face-to-face interview sessions where we go through almost every single question because we have been in NHS for decades, and so we know what sort of the questions they could ask. We give them CBT courses resources. We prepare them for appraisal revalidation. We create their job profile. We get them into GP surgeries or hospitals where they could do their placements and get their local references. And we help them to secure the job as soon as possible. So these are after passing your PLAB2 from your GMC registration till you secure your job, I will hold your hand at every step and every stage of it. And even after that, if you need further help, you want to bring your family, we have our legal team, and they will help and support you in changing your visa status and bringing your parents, your family into the UK. So Hive is the only academy which does support PLAB services and which provide everything after passing the PLAB. So make sure everybody gets the job and secures their job before their visa is expired. Dr. Mo, you want to add anything?
PLAB1?
No, that's great. Thank you. Yeah, I think Muzammal has a question.
Yes, I
please,
have a
yeah.
question regarding PLAB1. What's the best way for candidate to balance theory revision with question bank practice to maximize success and PLAB1?
Dr. Mo?
Yeah, I think that's a very similar question to one that was asked earlier. I think maybe Muzammal wasn't present in the webinar then, but it depends on the individual. When you register to prepare for PLAB1 with us, we have a consultation, we discuss your learning style, we discuss your strengths and your weaknesses, and then we give you advice based on that. Which I forgot to mention in the last answer, which Dr. Shkil kindly added on, was that we also give you a personalized study plan, which gives you clear instructions what to cover on what day. You can do things as you go along. So the good thing about our resources are that you can attempt the question banks by specialty. So things are split, or you can do them randomly. Sometimes maybe you might feel like not doing much studying, but you want to do some questions. Also, we have 10 mock tests as well in our resources. So the other way you can do it is you can prepare bigger chunks of the syllabus and then test your knowledge in a mock exam. So it really depends on the person, but we will discuss all of these kind of things when you register with us.
Have you got any more questions? Imtihal, you want to check if anybody else wants to ask any questions?
सर मेरा एक क्वेश्चन है
Yes,
जब रजिस्ट्रेशन मिल जाए उसके बाद हमारे लिए कौन सी स्ट्रेटजीज हेल्पफुल होंगी अपना एनएचएस जॉब हासिल करने के लिए?
ठीक है। जीएमसी रजिस्ट्रेशन के बाद आपकी रेट स्ट्रगल होगी। उसमें बहुत जरूरी जो चीजें होती हैं वो आपकी अटैचमेंट, यू मस्ट हैव क्लिनिकल अटैचमेंट। उसमें ये होगा कि आपको लोकल रेफरेंस चाहिए होगा, लोकल रेफरेंस मिल जाएगा। आपका सीवी अप टू डेट होना चाहिए और एनएचएस के टेम्पलेट पे। अगर आपका सीवी सही नहीं है, उसमें गैप्स हैं, प्रॉपरली वो चीजें प्रेजेंट नहीं हुई है, योर सीवी इज योर प्रेजेंटेशन। इफ यू डोंट प्रेजेंट इट वेल, इट वुड नॉट लुक गुड। उसके बाद सीबीडी कोर्सेज, कंटिन्यू प्रोफेशनल डेवलपमेंट कोर्सेज होते हैं, वो बहुत जरूरी होते हैं, वो आपको करने चाहिए। दैट विल बूस्ट योर सीवी अप। फिर उसके बाद आपको पता होना चाहिए कि आपने कौन सी स्पेशलिटी में जॉब के लिए अप्लाई करना है, कौन से हॉस्पिटल में अप्लाई करना है। If you are not capable of working in orthopedic or gynae and you keep applying in orthopedic and gynae, मुश्किल हो जाएगा, आपको जॉब नहीं मिलेगी। तो ये जब 1-to-1 कंसल्टेशन होती है कंसल्टेंट के साथ, वो आपका सीवी रिव्यू करते हैं, आपकी कैपेबिलिटीज रिव्यू करते हैं, फिर आपको गाइड करते हैं। दिस इज कॉल्ड करियर काउंसलिंग कि यस आपने एएनई में अप्लाई करना है, ज्यादा चांसेस है आपको जॉब मिल जाएगी विद इन कपल ऑफ वीक्स और कपल ऑफ मंथ। अगर आपने इसमें है मेडिसिन में है तो इसमें आपने जॉब करना है। तो ये अवेयरनेस और ये गाइडेंस बहुत जरूरी होती है। तो ये ना हो तो आप एप्लीकेशन भेजते रहेंगे, 1000 के हिसाब से, you never get shortlisted. उसके बाद इंटरव्यू, आपने इंटरव्यू में जाके क्या करना है? इंटरव्यू में nobody going to ask you कि आपने प्लैब पास किया है या प्लैब में गोल्ड मेडल लिया है या फर्स्ट अटेम्प्ट में या थर्ड अटेम्प्ट में पास किया, अब यू ग्रेजुएटेड. nobody going to ask you. इंटरव्यू की सेपरेट प्रीरिक्विजिट है, वो आपसे वहां पे पूछेंगे क्या जॉब की डिस्क्रिप्शन क्या है, आपने वहां पे कैसे चीजें हैंडल करनी है और वहां पे कम्युनिकेशन कैसे करनी है. आपने वहाँ इंटरव्यू पैनल में बैठे हैं, आप उनको कैसे रिस्पॉन्स करना है, आपका हर क्वेश्चन का आंसर कैसे होगा, किस तरह प्रोफेशनल मैनर में होगा. ये सारी चीजें वो सीखना बहुत जरूरी होती हैं. इसके अलावा अगर आप नहीं सीखेंगे तो नुकसान क्या होगा आपको? अगर कोई शॉर्ट लिस्टिंग आ गया, इंटरव्यू में गए हैं, वहां पे तो आप तो प्रिपेयर होंगे कि प्लैब मैंने पास किया होगा तो मुझे जॉब मिल जाएगी. ऐसा नहीं होता. थाउजेंड्स ऑफ अदर क्वेश्चन होते हैं. और हमारी हाइव के पोस्ट प्लैब सर्विस की ब्यूटी क्या है कि वी प्रिपेयर देम वेल टू सिक्योर द जॉब. वी ब्रिंग द स्टैंडर्ड अप. वो जो लोकल ग्रेजुएट्स होते हैं, जो यहाँ पे होते हैं, जिनको सारी चीजें पता होती है, जो इंटरनेशनल मेडिकल ग्रेजुएट होते हैं, हम उनको ट्रेन करते हैं, टीच करते हैं, पॉलिश करते हैं, ताकि उनके स्किल्स, नॉलेज, एक्सपीरियंस उनके लेवल तक पहुंच जाता है. देन दे इंक्रीज देयर चांसेस ऑफ सिक्योरिंग ए जॉब. तो मैं हमेशा कहता हूँ कि जितने भी इंटरनेशनल मेडिकल ग्रेजुएट हैं, तो कभी भी ये मिसकंसेप्शन या मिसअंडरस्टैंडिंग निकाल लें कि मैं प्लैब कर लूंगा तो मुझे जॉब मिल जाएगी, बस प्लैब मेरा पास होना चाहिए, उसके बाद जॉब तो प्लेट में रख के दे देंगे. ऐसा नहीं होता है. आपको हर चीज की, हर स्टेज की डिफरेंट रिक्वायरमेंट्स हैं, वो पूरी करनी चाहिए. सिंपल एग्जांपल है, दो कैंडिडेट हैं. एक कैंडिडेट कहता है मैंने प्लैब पास किया, मैं जाके जॉब करूंगा. तो एक है जिसने प्लैब पास करने के बाद ही डिडंट वेस्ट एनी टाइम, उसने सीबीटी कोर्सेज किए हैं, उसका सीवी अप टू डेट है, उसके कम्युनिकेशन स्किल्स बेहतर है, उसके मार्क इंटरव्यू के सेशन किए हैं. अब दोनों एम्प्लॉयर के पास जाते हैं, हु विल गेट द जॉब? ऑब्वियसली जिसके पास ज्यादा चीजें हैं. तो होप इट्स क्लियर. होप इट आंसर्स. कुछ ठीक हो गया, क्लियर हो गया?
ओके सर, थैंक यू.
Sir, I have a question.
जी जी please.
Am I audible?
Yes, you are loud and clear.
Okay. Sir, what role does mock testing or simulated patients play in preparation?
Dr. Thomas, is PLAB2
Yeah.
role
In
play
relation to PLAB2, yeah. So obviously, the more you can put yourself in the real exam scenario, or the exam situation, the better prepared you will be, and the more often you can do that, then that will help you a lot in your preparation. You know, putting yourself under that time pressure, ensuring that you do, as we discussed in the earlier case, imagine doing that telephone consultation. You see how many issues we discussed, how many things were important, how many things to consider, what's going through your mind, what am I going to do next, all of these kind of things, how am I going to say it, what am I going to do? You have to do all of that live as you are there in that situation within 8 minutes, actually within about 7 minutes, 30 seconds, because you know, entering the room takes time and leaving, etc. So the more you can practice, the more that you put yourself in that timed scenario, the better you will get. But there's a proviso to that, and that is that you're not just practicing alone or practicing with a peer, because the issue with that is then you're not having an expert eye looking at what you are doing, picking out any mistakes and suggesting ways to improve. However, if you have somebody who is experienced as an examiner, as a tutor, as a teacher, as well as a clinician in the UK, they can see what's happening and they can advise you and give you suggestions for improvement and tell you about things that are coming up regularly and how to kind of remove them issues or remove them habits from your consultations. So not just practicing with simulated patients or in time scenarios, but doing so where you can receive feedback from someone who's more experienced than you.
Sir, I have a question.
right.
Yes, please. Yeah.
So my question is that how will your interview preparation sessions help me go beyond just practicing common questions and actually build my confidence for handling high pressure NHS applications and interviews.
Yeah, Dr. Umar.
That's okay. So how we will do it in terms of job preparation is the same way in which we will do it for your PLAB1 and your PLAB2, which is giving you assessing your performance, giving you the knowledge and the things that you need to be aware of, remembering certain things, telling you how to express yourself better, telling you how to even sit and how to conduct yourself in the interview. It's the same way in which we will prepare you for your PLAB2 is the same way in which we will prepare you for an interview, which is putting you in that scenario, putting you under pressure, seeing what happens when you're placed under pressure, and then giving you advice to iron out those weaknesses.
I have a question regarding PLAB2. What practical strategies can candidate use to manage anxiety and boost confidence while performing in PLAB2 OSCE stations?
That's a very good question. If we tell you, we have a student, almost every international medical graduate, they will have some sort of anxiety. So the best way is when you have got one-to-one feedback, when you have got open and honest discussion, and you practice. Because when we are going to different country, every country has got their own system and transitions. When you're practicing in your country, you have got different reflexes developed. How you speak to patients, how you answer the patient, how you tell them the diagnosis, how you give them information about medication. Or you moving to different country, you have got a different style. So you need to adopt that style of the practice. While in PLAB2, GMC expecting what they want to see, the examiner want to see that how you're going to speak to patients. Are you polite? Are you going to treat the patient the way you want to be treated? I'll say that put yourself in patient's shoe. That if you are a patient and what you are expecting from a doctor, should he not treat you with respect? Should he not be open and honest with you? And should he not give you all those information honestly? And should he not be very professional and honest and open? So this is what GMC is expecting, that you're good communicating, you're putting patients as a comfort, you're explaining all those things. What happens in Hive PLAB2 course in the academy, and this we give them chance to practice. We give them more than thousands of scenarios where they go through the cases, where they discuss, and then they get the one-to-one feedback. Myself and from Dr. Umar, we give them feedback, and we improve all their weaknesses. Whatever their weaknesses, whatever the bad habits or reflexes to practice, we ask them to stop those. Because you are moving to different country, you're going to practice in the UK, you need to adopt these new reflexes. Sometimes it takes a couple of days, but after 10 days, they are completely different doctors. They get used to using the proper language, proper professional attitude, and they speak to the patient of whatever the GMC or good medical practice guidelines expecting. Dr. You want to add something more about?
I would just like to add that we also we don't teach scripts in our academy. We don't get people to memorize cases and memorize what to say, because that's not a good way to prepare people. But we do teach them structure. We do teach them structure to the consultations, pillars of consultations, things for them to remember, because in exams you will suffer anxiety, you will go blank, and then you can fall back on the structure that you were taught and start again from a particular place. If you don't have a structure that you've been practicing, then you can struggle with how to move forward. So structure is extremely important in helping with coping in a blank kind of scenario or in an anxiety type of scenario. But we teach them we teach them skills to deal with what's in front of them. And so the more you can practice, the more they gain confidence and the less their anxiety will be an issue come exam day.
Imtihan, over to you. If there are no more questions, then you can move forward.
Any questions?
I have another question.
Yes, please.
Yes, I do.
Yes, please. Yeah.
What about the expenses incurred at Hive Medical Academy after GMC registration and securing an NHS job? Will those costs be reimbursed or not?
Very good question. Yes, every single penny you spend for your PLAB journey, you will get reimbursed. When you start your first job, you'll get every single penny back. So keep record of all your expenses. The day you started preparing for your English test or for OET, whatever money you spend for your IELTS, PLAB1, PLAB2, and after post PLAB, everything you'll get back. And these are top up on your pay. Your pay is different, but you will claim back all these expenses.
Okay, thank you so much.
I have a question, sir.
Yes, please.
My question is, what makes Hive's approach different from other academies, especially for IMGs who feel usually overwhelmed or isolated during these preps?
Very good question. The first thing, the beauty of a Hive is it has got a diverse talent. I myself, IMG, I have been through the journey. I completed my all training from junior doctor to consultant, been in NHS for 20 years. So then we have got Dr. Umar, who is our academic lead. He's local born and bred. He graduated from Liverpool Uni. He's been a tutor, examiner in the Manchester University. So we bring diverse talent, skills, experience, and dedication to support them. Secondly, our programs, all our programs, they have got the best everything. Very economical. We have got all the content we prepared from the scratch. Our PLAB1 content we have got according to latest GMC UKMLA blueprint. There's nobody else at the moment, anywhere in the world offering these sort of the content, these sort of the courses. We have audios, videos, we have got flashcards, we have got maximum mock tests, and everybody gets personalized and very focused attention from us. We both are available, even all our teams, they are available 24/7. All our doctors, I think Dr. Shahid, who is one of our students, and he will second all these things, that how quick we respond to everything. And we just don't prepare them, we help them, in everything. Either it's a visa application, either the CV, either arranging the clinical attachment, or either arranging the accommodation, or picking up from the airport, again, getting them local SIM. And even after that, if they want to buy a house or if they want to get married, we provide answers to the and on the one roof. So Daksha, do you want to say how was your experience with us from PLAB1?
Of course, that's why I unmuted. Basically, it's been wonderful. Both of you, yourself and Dr. Umar, anytime I ring the bell, I send a text, I get the response within a few minutes, majority of times, if it is not working hours. Of course, everybody works, but I do get response very early, within a few minutes, probably most of the time, and any kind of question. I keep disturbing Dr. Shakil for so many different diverse topics and diverse questions. I think maybe nobody has more questions than I have. And every time I get response and very calm and that voice is very reassuring. Don't worry. Every time I hear from him, don't worry about that. Don't worry about that. So all the questions I have, I always hear this from Dr. Shakil and also Dr. Umar. Every time. Believe me, I'm not exaggerating. I'm not oversaying it, but I don't have any issues at all with the communication with Dr. Shakil and Dr. Umar. They've been really helpful and guiding me in some right way. I was very wrongly you can say directed by somebody, but I gather myself after having conversations with you guys, and it turned out to be quite useful and helpful.
Thanks so much, Dr. Shahid. Very kind of you.
Dr. You want to add anything?
No, I mean, I think what Dr. Shahid said speaks for itself. I don't think you need to add anything more.
But I'm not talking to Dr. Umar for 1 week. I'm not talking to Dr. Umar for 1 week.
No, it's a long time.
You said, just joking. You said, where we coming from. Dr. School situation. Yeah, no, just kidding.
Okay.
Just kidding.
Yeah.
Yeah. So we have another question. If someone has cleared PLAB1 and PLAB2, but for any reason hasn't been able to secure the job in the NHS, can they still complete the GMC? Yes, we answered this one. Yes, you can. Nobody can stop you. Make sure, one of the candidates invited to Manchester for the PLAB2 through Hive Medical Academy can they clarify exactly who pays the expenses. The tutoring, the teaching, training expenses, we bear everything. So obviously, rest of the expenses they have to bear. If they want us to do it, obviously we could help them, we could guide them, but they have to book their tickets. They need to pack their stuff, and they need to walk to the airport to sit in the plane. We could pick them up from the airport. We could help them to get the accommodation and everything. So all these expenses, they will get back. Once they start their job, they will get back. So that was the question in the chat box. Anything else, Imtihal? Anybody else wants to ask any questions?
Any questions?
So then you can move to Mariam. Yes, Mariam, you want to ask?
Yes, I want to ask something. That if I'm not able to secure an NHS job immediately, will Hive Medical Academy guide me on exploring alternative courses and options or pathways after completing my GMC registration?
Fine. If you have passed your PLAB, you have the GMC registration. Our aim and target is to help you to secure your job within 6 months because you will have 6 months visa. So that's the top priority will be to secure your job, and we'll do every single thing which is required for you to stand equal to local graduates and to secure the job. If unfortunately, you could not during those 6 months, then we take things individually, like a candidate by candidate. If you want to stay in the UK after that, we could discuss with you, we could involve our legal team and help you out about that, what are the best for you. We don't usually recommend any other courses because you are already a doctor and we don't want you to waste your money to go and something which is not helpful. But we could discuss at that time. But our top priority is always for all the doctors who are coming to make them able to secure their job within 6 months. Once they have got a job, one job they need and the visa status will change. And other thing is, especially doctors coming from Pakistan, we always say that, they must try to secure their job within 6 months. Because if they don't, and if you go back Pakistan is unfortunately is in red list because of code of practice. And what that means for the doctors, if somebody who has passed the PLAB has got the GMC registration, but he's gone back to Pakistan, and if he is going to apply for the job from the Pakistan, very unlikely he'll get any job. Because of this code of practice, none of the employer could offer him any job in the UK. So that's why we try our best for our candidates to make sure they secure their job within 6 months. By rare cases, if somebody is not, please speak to us because we have our legal team and they have got lots of other options which could help you, like to either stay longer or whatever, is depending upon the individual candidate situation and circumstances. But we definitely help and support.
Thank you, sir.
Hope that answers the question, Mani. Any
Yes,
other
sir.
questions?
मेरी
Yes, sir.
question है.
Yes, sure. No other questions? They go on. Yes, please, yeah.
4 candidates invited to Manchester for PLAB2 thought Hive Medical Academy. Can you clarify exactly who bears the expenses? Does the academic cover them, or do students have to pay on their own?
Honest. The expenses, when they're coming to take the PLAB2, there are the expenses. One is, if they are registered with us and they paid for the PLAB2 face-to-face course and online course, that's the paid, right? Rest of the expenses, if they are staying here, if they are in our global medicine program, they will have 10 days accommodation. We'll pick them up from the airport. They will have local SIM. But rest of the expenses, like obviously they need to survive, they need to eat and drink and food and other things and traveling, they have to bear themselves. But good thing is that whatever expenses they do, till they get the job, they'll claim back. They'll get money back. So these are individual expenses when they're moving here, because they will be working and earning much more than anybody else. If they get the job, they'll be working 100 to 100 pounds per hour. So that's the sort of the investment they're doing in their career and their life, which will help them. Hope that's clear. There was another question. Somebody wants to ask.
Thank you.
No worries. Thank you.
Any questions? I think they have end of questions now.
So somebody else that didn't see has got one question. If not, then yeah, I would see you.
So all thanks to Dr. Shahid. He asked the first question and then it was like non-stop afterwards.
Maybe I can ask the last question as well. Just a funny part. Asking
Go
Dr.
on.
Shakil, he just mentioned he can help people getting married. What about those who want to go for the second one?
I'm working from home today, so you want my wife to kick me out as well?
I think that's an appropriate point to end the webinar.
Okay, thank you. Just kidding.
We know. It's okay.
I wanted to say that, the IMGs, they don't feel like alone with us. This is how we support them. This is how we help them. And especially we understand. Some of the other candidates, they said, somebody asked him, why did you join Hive? And he said that, these are the people who understand me. They speak my language. They understand what I want. And they help me. This is what we do. We try to put you guys in heart of everything. You are our focus.
Right.
We understand, because I know when I speak to any IMG, and I know when I was there at their situation. So completely understand all their fears, all their, worries and concerns and obstacles. So I exactly understand, because I have been through that journey. Clearly understand. So this is how we put them at center of everything. They are in the heart of everything.
Right.
Yeah, to you, Imtihal.
Any questions, or should we end it here?
I think Dr. Shahid has asked a question to end all questions for today.
I thought that was a good offer, so why not explore it?
We'll think about it.
Yeah.
Thank
you. Thank you.
Thank you for attending, everyone. It's a pleasure as always. Thanks so much.
Over to you for closing.
Yes, as we come towards the end of today's session, I would like to sincerely thank you, our esteemed speakers, for their time and guidance, and our listeners for their active participation. We hope today's discussion has added value to your journey and inspired you to move forward with confidence. Until next time, stay connected with Hive Medical Academy, where we continue to guide, support, and empower international medical graduates. Thank you, and Allah Hafiz.